Welcome to an introduction into the functionality of our 4 WSIC HIU dashboards. Our HIU dashboards can be found under the Population Health product and consist of admissions, arrival method, attendance, and numbers by site. Let's take a look at our admissions dashboard. This dashboard shows the number of HIU patients, number of admissions, and the average cost of admissions by provider site. This dashboard also gives you an insight into the HIU frequency of patients. Once you have selected which network, practice, or PCN you are most interested in, you can start to focus on other parameters. The patient segment filter is another very useful filter to enable the user to select cohorts of patients with particular health needs, to proactively target vulnerable patients and manage them effectively. The line graph below represents the monthly cost of admissions over a 12-month period, and the bar chart represents different provider sites broken down into the number of patients admitted versus not admitted. One of our most common questions is, how can I view the most frequent A&E attendees within my practice or PCN? This intuitive dashboard allows you to do just that and support proactive case finding. PID level users will be able to access an additional dashboard called Patient List, which can be found within the existing admissions dashboard by clicking on the Patient List button on the top right. The patient list will only show you patient details of whom you have a legitimate reason to view. Once you have selected which network, practice, or PCN you are most interested in, you'll be presented with a list of patients who have had frequent emergency attendances. You can then start to focus on what type of emergency attendance you would like to see, whether it be A&E, consultant-led monospecialty, urgent care centre, or walk-in centre. You can also alter the HIU frequency to suit your needs. Alongside the patient details, you should be able to see the HIU frequency, month of attendance, arrival method, hospital site, type of attendance, and whether or not they were admitted. Provider sites, shown as Other, represents patients who attended hospitals outside of North West London. Clinical users can now focus on patients who are high intensive users and manage them effectively. Now let's navigate to our arrival method dashboard. The arrival method dashboard shows the number of HIU patients and the method by which they arrived. Users can now alter the results based on the filters to show a breakdown of results by provider site and percentage of arrival via ambulance. Hovering over these results will give you further information. Now let's navigate to our attendance dashboard. Once you have selected your chosen PCN, practice, or network, the HIU dashboard will present the number of HIU patients by provider site over a period of time. This dashboard also shows a visual representation of attendance by age. Lastly, let's have a look at our final dashboard called Numbers by Site. This dashboard shows the number of HIU patients and the average number of attendance per patient by provider site over a period of time. All HIU dashboards allow for population health management by allowing commissioners, integrated care leads, etc. to focus on the effects of HIU on service providers and the impact on the population. in order to implement appropriate strategies to alleviate pressures within the North West London patch. If you feel WSIC dashboards will be beneficial in supporting proactive case finding and improving patient care within your North West London area, please request access by emailing nwlccgs.wsic.dashboards@nhs.net. Thank you for watching.